I'm Dr. Brett Gilbert, board certified endodontist, and I've been doing endo for over 20 years, and I love getting out and exploring what's new in the marketplace, and I wanted to bring that information to you. So let's get busy discovering together and explore what new products are out there. This episode features products from SS White. SS White is a company that's been around since 1844, started by Samuel Stockton White. And as they've evolved over time, they developed a line of endodontic products that really is related to dentin conservation, to minimally invasive treatment. So I wanted to go through a few of the products that I've tried to share them with you and see if they might be good options for you as well. The first is going to be the Exact Taper DC. So the DC stands for dentin conservation. And so this is a minimally invasive file. I'm going to go through each of the files in this assortment to show you that it's very similar to some of the other products on the market as far as the terminology, the sizing, but they're very flexible, very strong, and mostly they're very slim, which is very nice. So the other products I want to go over are going to be the Endoguide. These are going to be access and then ultimately canal, location, and preparation burrs. So these burrs come in an anterior bicuspid kit, and then they also come in a molar kit. And we'll go through the details of each of those. Lastly, I'd like to discuss the SS White Bioceramic Sealing Agent. So this is going to be MTA based. It has a dual paste system that is base and catalyst, and the mixing tips come with the kit. So let's get in and learn a little bit more about each of these products. So with the Exact Taper DC system, it's going to be very familiar to many users of the Pro Taper system. Many of the companies have mimicked some of the terminology, the sizing, in an effort to allow a doctor to move into a new file system without having to really change the particulars and the flow of what they normally do in their practice. So the first file in this sequence is the SX file. This is an orifice opener. The sizing of this is a 15 with an 09 taper, and it comes in a 19 millimeter file. That's the only length of the file because it's meant to be used in the coronal third for orifice shaping. Very nice, very flexible. The next is going to be a glide path file. This glide path file is actually a 14 with an 03 taper. Now this file comes in 21, 25, and 31 millimeters. This is a very thin, flexible file that's meant to eliminate the fatigue of hand filing. Again, the metallurgy and the heat treatments that are used on these modern day files allow you to really forego the use of hand files to make that initial glide path preparation. The next file is the S1 file. This is a 17 at the tip 03 taper. This also comes in the 21, 25, and 31 millimeter file sets. This will be your initial shaping file that you will take all the way to working length following that glide path preparation. This does a lot of the work for you in regards to preparation of the canal. The next file is the S2 file. The S2 is an 1804. So this is just a slight increase in the tip size as well as the taper. And this also is 21, 25, or 31 millimeters. This is going to finish off your deep shaping. And the key here to remember about these files is that they have a maximum flute diameter of 1 millimeter. So by D12 on the file, you no longer will see any increase in the taper. These are slim, strong files. And so with the S2, you'll finish off your shaping. Then ultimately, you're going into your finishing files. So this is going to be some refinement. And this is going to be the F1. This is going to be a 20 at the tip, 06 taper. So again, you've created your glide path, you've done your shaping with S1 and S2. This is going to allow you to finish off at a 20 tip size, which would be totally appropriate, especially for smaller canals in the dentin preservation model. And then ultimately, you have the F2. The F2 is going to be your 2506. This is going to be the finisher file that will allow you to finish your preparation at a 25 preparation. Now there is an F3 and F4 that's not a part of this variety pack. The F3 is a 3006 and the F4 is a 4006. So with the Exact Taper DC file system, you can really create very nice shapes that have a slim profile, still giving you a great look on your final x-ray and creating enough space to allow you to irrigate properly. So Exact Taper DC for dentin conservation, very nice file to use. I've used these in my practice and gotten really nice results with them. So the next product we're going to review is the Endoguide Precision Microendodontic Burrs. Now there's two different sets. There's an anterior premolar or bicuspid, and there's a molar set. Let's take a look at the anterior bicuspid set. So there's 3 different burrs in here for access. The first is going to be the Great White 1. So Great White 1 is a burr I'm very familiar with, very well known as a transmetal burr, a great way to work through porcelain fused to metal crowns, being able to open things up very effectively and efficiently. So that's the Great White 1. We next have the Great White Z. So the Z stands for zirconium, and it has these piranha diamonds built in. So this is probably about a number 6 round burr used with cool water spray. This is a great opportunity to penetrate into zirconium crowns, do it precisely and efficiently. Next is going to be a Great White Z tapered burr. Again, with the same piranha diamonds, very effective at cutting into glass restorations so that you can keep them intact, but also move the procedure along, because we all know that zirconium can be very difficult to cut through. The next part of this set that really gets interesting is the EG burrs. So this is going to be the EG1. Now this burr is actually a right angle latch type burr that goes into a slow speed handpiece. It has a nice conical head with precision cutting ability. So you can get in and you can start to locate MB2, you can find the different canals, start to refine your orifices. Again, these are a great burr option for a doctor that doesn't have ultrasonics or isn't used to using ultrasonics. These have very much the same visual tactile ability as ultrasonics. Now the next burr in here that's really to me the superstar is the EG1A. Now this is going to be a friction grip high speed burr. Now this burr has been really fun for me to use. We all like to make small access at the beginning, especially pinpoint, precise, and the EG1A does just that. It is an opportunity to enlarge, and you can enlarge with it very well, but if you wanted to have a very slim, small pinpoint access, this is your burr, and I've really enjoyed working with this. The EG2 is going to be, again, back to the right angle, slow speed handpiece latch type. Now this has a little bit of a slimmer but longer cutting head. Very precise. Again, a great opportunity to go a little bit deeper in your troughing looking for canals and to refine the orifices. And then lastly, the EG3. This is going to be a high speed burr, friction grip. This is going to have a little bit of that longer shank. It's got a much slimmer head on it, so you can really get down and start to trough and locate canals. This is a really, really precise micro burr. So again, this is the anterior bicuspid Endoguide Precision Micro Endodontic Burr Kit. The next product is going to be the Endoguide Precision Micro Endodontic Burrs. This is the molar kit. So there is some redundancy to the anterior bicuspid kit, and let's go through each one. So you have the EG1, again, right angle, latch type, slow speed. This is going to give you that great penetration to be able to search for canals, find MB2, etc. The next is the EG2. Again, this is going to be the slow speed latch type. The EG2 is going to have this nice conical head, very precise, great for searching and troughing for canals. The next one is going to be the EG3, which we discussed. Friction grip, longer shank, very slim, sharp profile. In fact, if you put your finger on it too tight, it will stick into your finger. So very sharp and precise for location of canals and refinement. Next is going to be the EG4. So this again is going to be friction grip, a little bit of a longer profile. This has a 3.5 millimeter cutting head that's very, very slim. So this is again precision, micro touch, tactile feel, locating canals, getting into very, very small orifices. As we move on into the set, we now have the EG5. Now these are all going to be a longer shank, and these are all the right angle latch type handpiece, slow speed. So this is going to be for deeper refinement and troughing, and you carry through from the EG5 into the EG6. EG6 has a slimmer, smaller head. It's a little bit longer. Now we're talking about deep, deep penetration, and because we want to improve the visibility, the longer length of these burrs is very, very critical. And finally, we get to the EG7. The EG7 has a smaller head. It's very pointed, and again, this is for deep troughing, for locating missed canals. This is again an opportunity for a doctor that does not have ultrasonics to use their handpiece for this purpose, or if you do have ultrasonics and just want to keep things super clean, super slim, the Precision Microendodontic Burrs, the Endoguide, is a very nice option. The next product is the SS White Bioceramic Root Canal Sealing product, and you can see here it comes in a dual paste system. So you have a base paste as well as a catalyst paste, and it comes with these mixing tips to allow you to mix it effectively. A few of the properties about this bioceramic sealer that are significant is that it is formulated to an optimum pH, which elicits antibacterial effects and definitely encourages new tissue formation. This sealer is actually MTA based and is actually a 13% MTA, of course, mineral trioxide aggregate. And this is going to give you an opportunity to have a dual mix syringe that will be easily mixed and really helps with the storage issues that we sometimes see with bioceramic cements. There's no need for low temperature gutta percha use. This can be optimally used with the higher temperature techniques of warm vertical and single cone. The working time is 23 minutes once the pastes are mixed, and ultimately the set time is reported at 130 minutes. So this is another one of the bioceramic sealers on the market that I wanted you to be aware of. Again, it does have this dual mixing system with the tips, and there are a few different ways that you can dispense this for use, which I will share with you later in the video. Okay, so we're here in the clinical simulation setting, and let's take a look at this exact taper DC sequence. So we're going to start out with the SX. Again, this is going to be the shorter coronal shaping orifice opening file. The manufacturer recommends about 350 RPM. I personally enjoy spinning at 500. You can try either way. They're very effective at either speed, but I'm going to spin these at 500 here. And what I'm going to do is bring in this SX, and you're going to see it's really just meant for that coronal third. So I don't have to go much beyond that. You can see I'm here in the MB2. It's able to kind of traverse it very nicely into the palatal here. And so the SX gets it all started, coronal shaping. So now I'm here with the glide path file. This is going to be a 1403. Again, very flexible. You can see the instrument is very flexible. It does have controlled memory to it to some degree here. And so what I'm going to do is bring this in. Again, I'm spinning at 500. You can go anywhere from 350 to 500. And this is very, very flexible. As you can see, even just how it wraps around the little curvatures. Let's bring it into the MB and kind of see how it traverses down inside here. Here we go. So you can see it right down here. And then let's take a look in the MB2. In the MB2, the most tortuous of this tooth model, let's take a look at it here. So we're going to come down, you're going to see it just able to glide right down to the apex. Again, it's a smooth insertion, you're not forcing it, and this allows you to avoid much of the hand filing that we typically had to do historically. Again, very conservative, the dentin conservation system. Then we're going to go ahead to the S1 file. So the glide path file was a 1403. This is a 1703. So again, I'm going to bring this down into the preparation. We're going to activate, and you'll see that it flows down very, very easily and nicely right to the working length. So now I'm creating my shape down with the S1. I'm going to go ahead now with the S2. The S2 is a 18 at the tip 04 taper. So just a slight increase in tip size and taper from the S1. S2 is going to, again, just kind of flow down here. Kind of see that it's very curvaceous, it's very flexible, goes around here. You can just bring it in and out. Now we're always checking the flutes, we're always cleaning debris, but we've already done some incredible shaping just with these few instruments. Now the finishers are going to be the F1, and this is going to be a 2006. And so I'm going to bring this in, and again, I'm just doing some very conservative shaping and bringing it in. This could be my last file that I use. Again, remember, you have the maximum flute diameter starting at D12. So you can see that at the top of the file here, it's very, very slim profile. Finishing it off here with your 2506, this is going to be your F2. So very familiar terminology to many who have used these rotary systems in the past. And again, 2506 with all the pathway that we have created, very slim profile, allows you to get up to a 25. There is also an F3 and an F4 if you wanted to enlarge to a 30 or 40. In this case, I'm going to stop here at the 2506, the F2, and I've gone through the entire exact taper DC system. It's a very smooth flowing instrument. Again, very conservative in removal of dentin. It's very flexible and ultimately really able to work quickly through these files because there's not a lot of friction or engagement because of the slim profile. So the exact taper DC system in the action clinically. Okay, so let's take a look at the Endoguide Micro Precision Endodontic Burrs in action. I'm going to go with that EG1A that I've been telling you about. Again, it's a friction grip. It's got the nice conical end, and this is a burr I've become really in love with as I've been using it. So what I'm going to do is I'm going to bring it into place, and you're going to see right away it's got this really nice conical end that makes it very easy to apply to the tooth. It gives you quite a bit of good visibility here, and so wherever you're going to go, you have this nice long shank which gives you a great sense of the long axis and being able to pinpoint precisely get into the pulp chamber. So I'm going to come in and activate the pedal, And when I do, it's going to allow me to get right into a really just, you'll see just a pinpoint. Again, this is plastic, so it does make a little bit more of a burn. And you can see how small that entry point is. So I can extend that as much or as little as I want, but I'm going to make a little more penetration. Again, you have such a good tactile feel with this. It's really incredible. And you can see that as I progress, I can brush along the sides, I can apically direct, and ultimately feel myself fall right into the pulp chamber. Okay, so from the Endoguide molar set, let's use that EG7. So that's going to be that last part of the EG series. Again, this is going to be that right angle friction grip that goes into your slow speed. And now I have this incredible precise instrument that I can use to start to locate canals, refine my prep. So I'm going to bring this in, obviously going to spin a lot slower on the slow speed handpiece. And again, look how the long shank really gives you an opportunity to see very well. So again, if I was going to be troughing inside a chamber, trying to find MB2, trying to find any other canals, enlarge and sort of negotiate and start to really refine my canal preparations, especially the coronal third, the EG7 does a great job of that. So we have this full range from the great white burrs right up and through the EG series to be able to get into the chamber, be able to find canals, refine them, trough. So again, without ultrasonic activation, you have the ability to do that with rotary burrs using both your high and slow speed handpieces. So I'm here with the SS White Bioceramic Root Canal Sealer. We're going to do a little clinical simulation to show you how it works. So first and foremost, I've attached a little mixing tip which will allow the base paste and the catalyst paste to mix together very efficiently. So you're going to see it come down, and this is going to be a nice mix right at the site. So we're going to push it out, and we're going to put a little bit here to demonstrate the warm vertical technique. And we're also going to put some into a little Centrix tube. So by adding this here, this will allow me to facilitate putting the sealer directly into the tooth and right into the canal, like so. And then we put a little stopper in. Terrific. So let's go ahead and show the technique. So what I'm going to do is I'm going to go ahead and I'm going to bring my cone in, and I'm going to just coat it with the sealer. Get a nice coating just on the apical third here. And then I'm going to bring in my little plastic block here, a little simulated canal. And I'm going to bring this in and bring it right down to working length. And then I'm going to pull it out just a little bit and seat it back in, just like so. So this is going to be the warm vertical. Again, this sealer is able to tolerate the heated techniques. So I can bring my System B tip in, do my down pack, trying to get to about 5 millimeters from the apex. You can see a little extrusion of sealer there at the apex, and bring it back out. I'm going to go ahead and do a little condensation here with a plugger. And now we've got a great apical seal that we can now backfill with gutta percha very easily. Now the key here with the backfill portion is you always want to rub the backfill tip with a little sealer. So when this sealer comes in contact with the gutta percha already in the canal here, and then I go ahead and activate, look at what happens. The sealer, the gutta percha, and everything meld together, giving a beautiful fill there. So now let's take a look at this single cone technique using the SS White Bioceramic Sealer product. So in this case, I'm going to actually introduce the sealer directly into the top of the canal. So you can see I've got this Centrix tube set up, and it's going to express the sealer just in the coronal third like so. Now when I bring my gutta percha in, I'm going to bring it down, and you're going to see that it's actually going to take, and this is really what's called hydraulic condensation. So as I bring the gutta percha down, it's going to have some hydraulic condensation to bring the sealer all throughout the canal. With this technique, we're really just going to essentially just kind of cut it off at the coronal orifice, give it a little condensation, and you can see that this sealer product does flow nicely. It gave a nice coat inside the canal. It was easy to handle, and some of the issues that we have with moisture and humidity on the premix products doesn't exist because of the mixing tip. So this is the bioceramic sealer from SS White in clinical simulation, so I wanted to share that with you. I hope you've enjoyed learning more about the products from SS White. In this episode, we covered Exact Taper DC. This is a minimally invasive endodontic file that allows you to have great performance and really conserve the dentin that we're so concerned about to prevent fracture of teeth. We also talked about the Endoguide Micro Precision Endodontic BURS set, both the anterior bicuspid and the molar set, for use in locating canals, accessing canals, again, keeping this dentin conservation, this two-structure conservation at top of mind. And lastly, we covered the bioceramic root canal sealer from SS White. showing you the mixing tip and how to use it in both the warm vertical and the single cone hydraulic condensation techniques. I give all of these products my seal of approval, meaning that I've used them in my clinical practice, I have vetted them, and I think they're a great option for any dentist who's doing root canal treatment. So I hope you enjoyed this video. If so, please like it and subscribe to my channel. Also, leave any comments or questions below. I would love to hear from you. I would love to interact with you. And if you have any products that you'd like me to review, please let me know. Leave a comment and I'll get back to you. So thank you for watching the video and have an awesome day.